Hi there, this is Mrs. Hall again with your module on removal of the gastric tube. You can find the links to all these videos in this series, Nursing 3101L, in the description box below. Now, after we've gone through the process of having our patient remain with the NG tube for whatever period they may remain with it for, we are then instructed, hey, pull that tube out. So of course you are going to perform hand hygiene as is indicated in our video in the link below, and make sure that you pay attention to all kinds of infection control procedures and asepsis when it comes to pulling the tube out. Of course, you're going to make sure you introduce yourself to the client, verify the client's identity, ensure that all the protocols that you're supposed to be following are followed. Explain to the patient what's going to happen, what to expect, and what their role is supposed to be in this whole procedure. Make sure that you provide some privacy. This could be a little bit messy. So what you're going to do then is detach the NG tube from anything that it is attached to. A drainage bag, a suction pump, anything that it's attached to. You make sure that you detach it. The tube is usually pinned onto the patient's clothes or taped somewhere else. You make sure you remove all of these secured features for the patient. Optionally, you can push through about 50 cc's of air in the tube just to make sure that any remaining feeding or gastric content would be back in the stomach before you pull it back out. You ask the client to take a deep breath in and hold it. This is going to close the glottis and prevent accidental aspiration of gastric contents. So you pinch the tube with the gloved hand, which does make sure that the fluids will not escape once you pull it out. So you pinch the tube, and then you have that patient take that deep breath and hold it, and you pull the tube out in a controlled manner because you don't want to flick the tube and end up with gastric contents all over your room. So now that you have this taken apart just like this, you have it out the patient, you are going to make sure that you get rid of it. Easy way to get rid of it, a bag that you can find, is your glove. Go ahead, wrap up your tube in your glove, dispose of it, make sure that your patient is comfortable, do all your documentation, record removal of the tube, any appearance of drainage, any kind of difficulty that had happened while you were removing the tube, and anything else that you can think of that affects the removal of the tube. So that's it, quick and easy, removal of the NG tube. I'll see you guys.